This video from the Royal Centre for Disease Control presents to you the procedures for collection of specimens from a suspected COVID-19 patient. We will take you step by step on each type of specimen, the materials required, and the precautions to observe. Firstly, for collection of specimen from a COVID-19 patient, we recommend that there be at least 2 persons. The first person will be the sample collector, who will be performing the main task and handling the infectious works. He should be having a full PPE on, such as the coverall, gloves, N95 mask, head cover, face shield, water-resistant boots and shoe covers. The second person will be the assistant to the sample collector, who will be handling clean works such as filling up forms and labeling the tubes. He or she should have only basic PPE such as a lab coat, gloves, and a mask. Materials required for specimen collection are viral transport medium or the universal transport medium with swab sticks. These swab sticks should be plastic shafts with Dacron, rayon, or polyester swabs. The swab stick should not be made of wood. Before the collection procedure, the assistant will fill up the forms with necessary patient details and label the tubes. Once that is done, the assistant will exit the room. For the procedure to begin, ask the patient, if the patient is an adult, to sit comfortably on chair or lay down the patient, if the patient is an infant or a young children, in a supine position on bed with extended positioning of the patient's arms above the head. Hold the tongue with a tongue depressor. Use a sweeping motion to swab the posterior pharyngeal wall and tonsillar pillars. Have the subject say "ah" to elevate the uvula. Avoid swabbing the soft palate and do not touch the tongue with the swab tip. Open and put the swab into VTM. After inserting the swab stick into the VTM, before closing the cap, you may notice that the swab stick is longer than the tube. Look for a mark at the shaft of the swab stick to break it off. If there is no such mark, use a pair of scissors to cut off the shaft. Please make sure the shaft is not too long that it makes it difficult for you to screw the cap, and also not too short. Immediately close the VTM tube and store in 2 to 4 degrees centigrade till the sample is processed or transported to RCTC. Now for the collection of nasal swab. Ask the patient to sit comfortably on a chair and briefly explain the procedure. Hold patient's head slightly back by one hand. Advance the swab tip past the vestibule or the anterior nares to the nasal mucosa, approximately 2 to 3 cm from the nostrils in adults. Gently rotate to collect nasal secretions from the anterior portion of the turbinate and septal mucosa. Put the swabs into the VTM as done for the throat swabs. For collection of nasopharyngeal swab, again ask the patient to sit comfortably on the chair and briefly explain the procedure to the patient. Hold patient's head slightly back by left hand. Insert a flexible, fine-shafted polyester swab into the nostril and back into the nasopharynx. The swab is inserted following the base of the nostril towards the auditory pit till resistance is met. You need to insert at least 5 to 6 cm in adults to ensure that it reaches the posterior pharynx. Leave the swab in place for a few seconds and withdraw slowly with a rotating motion. Open and put the swab into the VTM.